If you ever wanted to watch a dictator go to war with a mosquito, you came to the right story. Burkina Faso just shut down a malaria program that was saving lives. Why? Because its military ruler, Ibrahim Traoré, believes that genetically modified mosquitoes are what? Western spies? Population control agents? Biological weapons disguised as bugs? It's hard to tell what's more dangerous at this point, malaria or the man claiming to protect his country from it. In a country where malaria kills thousands every year, the only thing being eradicated now is science. Traoré's regime has officially suspended Target Malaria, a project backed by the Gates Foundation aiming to reduce mosquito populations through gene editing. Not only was the project halted, its research was destroyed, its scientists exiled, and its intentions smeared with conspiracy theories. From eradicating disease to eradicating facts. Welcome to the new public health strategy. Fear first, evidence never. Let me ask you something. If your country was drowning in a preventable disease, would you trust science or the guy who thinks mosquitoes are CIA operatives? Comment your take. And if you believe logic still matters, go ahead. Like, share, and subscribe. Someone's got to bring reason back to the table. Let's set the record straight. Target Malaria isn't some shadowy operation cooked up in a billionaire's basement. It's a multinational, peer-reviewed, ethically approved project that brought together scientists from Africa, Europe, and North America to literally save lives. And in 2019, Burkina Faso became the first African nation to release genetically modified mosquitoes into the wild. Not secretly, but with full approval from its own biosafety authority. Transition. But don't let facts get in the way of a good witch hunt. Especially not when there's a new sheriff in town. And he's got a paranoia problem. According to the World Health Organization, Burkina Faso recorded over 11,000 malaria-related deaths in 2023 alone, with children under 5 making up a tragic majority. The Gates Foundation, which funds Target Malaria, has spent over $2 billion globally to fight malaria, supporting bed nets, vaccine research, new diagnostics, and, yes, genetically modified mosquitoes that reduce transmission by collapsing mosquito populations. In Burkina Faso, controlled field releases began after years of engagement with local communities, including public consultations and environmental reviews. This wasn't some drive-by science experiment. It was long-term, community-based, and transparent. So here's the hypothetical. If this had been a Russian-funded anti-malaria project, would Traoré still shut it down? Or is the issue not about mosquitoes, but about where the money comes from? If you're starting to suspect this isn't about science at all, say it. Comment, share, hit that like, because this rabbit hole goes deeper. Now, get this. The same year that Burkina Faso began releasing genetically modified mosquitoes, it also received $80 million in malaria aid from the Global Fund, another Western-backed initiative. So, just to recap, they're fine taking Western money to buy bed nets. But when it comes to Western science solving the mosquito problem at its genetic root, suddenly it's colonialism, because in Traoré's world, it's not about what works, it's about what narrative keeps him in power. Look, as an American, I've seen a lot of distrust in science, vaccines, climate change, 5G towers melting brains. But even the wildest fringes of American conspiracy culture haven't shut down disease eradication programs that were working. What Traoré's doing? It's Alex Jones meets Idi Amin, but with uniforms and AK-47s. Let's compare. We debate if Pfizer's shady. He debates if mosquitoes have microphones. If you're still with me and haven't facepalmed yet, comment below. Do you think scientific aid can survive in regimes like this, or is this the end of logic? Here's the part Traoré won't put in his speeches. Malaria isn't just a health issue in Burkina Faso. It's the leading cause of death, accounting for over 40% of hospital visits and nearly 1 out of every 5 deaths in children under 5, according to the Burkina Faso Ministry of Health. Yet, somehow, a program scientifically designed to fight it is being treated like a foreign invasion. In a country where the real enemy is microscopic, Traoré went looking for villains with microphones. Let's break down the science. Traoré doesn't want you to understand. Target Malaria's approach uses sterile insect technique, a proven method in pest control. These genetically modified mosquitoes can't reproduce, which means their population crashes over time, reducing the spread of malaria. This isn't some sci-fi Frankenstein operation. The same technique has been used for decades in agriculture to control fruit flies and tsetse flies, with documented success and zero evidence of ecological collapse. In fact, a 2022 study published in Nature Communications confirmed the viability of gene drive-based mosquito suppression as a long-term malaria strategy. And yet, after the 2022 coup, Traoré's junta ordered all scientific samples destroyed and suspended all genetic research in the country, according to multiple international news outlets including Reuters and France 24. Why? Because some Telegram account with a Z logo said it might be population control. Let's consider the possibility. If genetically edited mosquitoes were secretly Western tools of control, wouldn't they be deployed in places like Iran or North Korea? Why, then, are they released in full daylight, with public hearings and government sign-off? If this sounds more like political theater than public health policy, say it. Comment your take, and if you've ever Googled something before panicking, you're already ahead of Traoré. Like, share, subscribe. Here's what makes it truly surreal. The same government that burned research samples is still accepting malaria funding from the Global Fund and UNICEF, according to DVEX and UN News. They'll take the cash, the nets, the foreign-donated anti-malarial drugs, but not the one method with the potential to wipe out transmission altogether. Let that sink in. They want the money to treat malaria, but they're banning the method that could prevent it. In politics, that's called strategy. In medicine, it's called malpractice. As someone from the U.S., this feels like watching a house on fire where the homeowner kicks out the firefighters, but still cashes the insurance check. It's baffling, it's insulting, and most of all, it's deadly. Because every mosquito spared for political ego means another child buried for no reason. So here's the question. Can a government claim to defend its people while denying them the very tools that could save their lives? Drop your answer in the comments. And if you believe disease doesn't care about borders, donors, or dictators, hit that like and share button. Let's talk about the real virus spreading in Burkina Faso. It's not malaria, it's misinformation, supercharged by anti-West propaganda and conspiracy-laced narratives. Because when Traoré suspended the mosquito program, he didn't just kill science. He gave birth to a monster, the myth of biological warfare disguised as philanthropy. And, like most monsters, it didn't come from facts. It came from fear and just the right YouTube thumbnail. Since 2022, Burkina Faso has experienced a surge in anti-West sentiment, much of it amplified by pro-Russian social media channels and fringe websites. According to reports by France and the Africa Report, coordinated disinformation campaigns on platforms like Telegram, Facebook, and WhatsApp pushed narratives accusing the Gates Foundation of using Africans as test subjects, spreading genetically engineered diseases, practicing covert population control through mosquito sterilization. One viral post in early 2023, reported by Le Monde Afrique, claimed that Bill Gates is conducting illegal experiments in Burkina Faso to reduce black population growth. Zero evidence. Hundreds of thousands of shares. Now pause and ask yourself, if the same technology had been introduced by Russia, would these same posts exist? Or is the outrage selective, fueled by a political script? Comment your thoughts. And if you agree that misinformation is a disease in itself, spread this video instead. Like, share, subscribe. Traoré frames the ban as protecting national sovereignty, a noble phrase, a seductive slogan. But sovereignty without understanding is just manipulation with better branding. According to Deutsche Welle, many local villagers interviewed didn't fully grasp the science behind the Mosquito project, but were told by soldiers and local officials that foreigners are experimenting on your bodies. Meanwhile, community leaders who supported the program, scientists, health workers, even tribal elders, were publicly discredited and labeled as Western puppets. When the truth is too complex, fear becomes the simple substitute. Let me level with you. In America, conspiracy theories are a hobby. In Burkina Faso, they're state policy. And when governments start crafting narratives that paint life-saving science as a threat, that's not sovereignty, that's sabotage. You don't have to be a scientist to see what's happening. The real experiment isn't in the lab. It's on the people. How much fear they'll swallow before they start questioning the motives of their own leaders. If you see the playbook here, drop a comment. And if you think truth still matters in a world of digital noise, hit that like and share. A malaria program gets canceled. A dictator gains more control. Coincidence? Or was the mosquito never the real threat, but merely the perfect distraction? Because if you look closer, Traoré didn't just suspend science. He used the fear of it to centralize power. Where people saw a health crisis, he saw a political opportunity. And, like any clever autocrat, he didn't waste it. Let's talk timing. According to Reuters, Al Jazeera, and Africa Confidential, Traoré's regime has used anti-imperialist rhetoric as a core strategy since the 2022 coup, branding all Western influence, from military presence to humanitarian aid, as neo-colonial infiltration. Within just months of taking power, he expelled French military forces from the country, cut diplomatic ties with ECOWAS leaders, critical of the junta suspended multiple foreign-funded NGO programs, citing security risks, moved closer to Moscow and Wagner-linked military contractors, source DW, BBC Africa, and target Malaria. It was the ideal scapegoat. Science too complicated to explain. Foreign money easy to demonize. Mosquitoes impossible to defend. Let's be honest, wouldn't any fragile regime love a boogeyman that doesn't shoot back? If you were trying to consolidate power without triggering international backlash, wouldn't mosquitoes with microchips be a genius move? If you're seeing the game behind the fear, drop your thoughts. And if you think propaganda is more viral than malaria right now, share, subscribe. Let's fight disinformation with facts. This isn't just about medical programs. It's about controlling the narrative. As Reporters Without Borders documented, press freedom in Burkina Faso dropped sharply in 2023, with journalists reporting increased censorship on foreign coverage, limited access to rural areas, fear of retaliation for covering controversial topics like target malaria. According to RSF's 2024 index, Burkina Faso now ranks 82nd out of 180 countries for press freedom, down 28 spots since 2021. That means the same regime silencing scientists is also silencing reporters who ask why, because once you can kill a story about mosquitoes, you can kill any story. In the U.S., when the media asks tough questions, we argue on Twitter. In Burkina Faso, you get banned, blacklisted, or worse, disappeared from the conversation entirely. And let's face it, when both science and journalism are considered threats, you're no longer fighting disease, you're fighting democracy. So here's the final layer. Is Traoré fighting imperialism, or just using it as a smokescreen to build a regime of unchecked control? And if every dictator now claims sovereignty to reject humanitarian science, what does that mean for future medical interventions in fragile states? Let us know your stance. Comment, share, and keep this story alive, because silence is how the next malaria death becomes just another number. When Traoré banned target malaria, he promised a future free from foreign manipulation. What he didn't say was that future includes more deaths. In the months following the program's suspension, malaria cases in Burkina Faso didn't go down. They went up, fast. Because it turns out, mosquitoes don't care about your political slogans. They bite anyway. According to the WHO World Malaria Report 2024, Burkina Faso recorded a 7.3% increase in malaria infections in the first 6 months after halting target malaria. Hospitalizations rose sharply, especially in rural districts like Kaya and Bobo Dioulasso, where genetically modified mosquitoes were originally released in 2019. Meanwhile, The Lancet Global Health, April 2025, highlighted a troubling trend. Infant malaria deaths increased by 9%. Clinics in the Nord region faced critical shortages of artemisinin-based drugs, and the Ministry of Health quietly requested emergency stockpiles from the Global Fund, even as it doubled down on its anti-Western rhetoric. You see the irony? They're rejecting foreign science but begging for foreign pills. This isn't public health. This is performative nationalism at the cost of actual lives. So here's the question. If your kid was dying from a mosquito bite, would you rather have gene editing or government speeches? If your answer is obvious, drop a comment. And if you're tired of politics dressing up as healthcare policy, like, share, and subscribe. Let's bring reason back to the conversation. The Traoré administration calls this sovereign health policy. But according to Devex, 68% of Burkina Faso's anti-malaria funding still comes from foreign donors. Global Fund, USAID, the Gates Foundation itself. So sovereignty apparently means yes to your money, no to your ideas. That's not independence, that's hypocrisy with a national flag. When ideology becomes inconsistent, people stop dying for their country and start dying from it. From where I sit, in a country that argues about everything from masks to McNuggets, I still can't wrap my head around this. A program that showed promising results, passed ethical review, and had government support for years gets shut down because a junta read too many Facebook posts? In the U.S., we fight science with debate. In Burkina Faso, they fight it with fire and decree. Imagine if Alabama banned polio vaccines because they were developed in New York. Imagine if Texas burned cancer research because it came from a French lab. Would that be called patriotism? Or public health suicide? Let me know what you think. The comments are open. If logic still matters, hit share. When you kick out the scientists, you don't just lose research. You lose the future. Burkina Faso's decision to dismantle target malaria didn't just halt a local experiment. It sent shockwaves through the global research community. And now, those same institutions are pulling out, not just their teams, but their trust. Because in science, as in diplomacy, betrayal has a long memory. According to Nature Africa and Science magazine, multiple research institutions involved in the Target Malaria Consortium, including the University of Oxford, the University of Ghana, and the Institut de Recherche en Sciences de la Santé, IRSS, in Burkina Faso, have either suspended or drastically scaled down operations in the country. Here's what's been lost. 3 major international grants frozen by funders: Wellcome Trust, NIH, Horizon Europe. Due to instability, data collected over 10 years now inaccessible, with some of it destroyed under military orders, as reported by Reuters and Le Monde. Afrique collaboration with CRISPR gene editing teams now redirected to Uganda and Mali, leaving Burkina Faso out of regional malaria strategy plans. This isn't just scientific isolation, it's strategic abandonment. When the world stops trusting you with a microscope, it's only a matter of time before they stop trusting you with anything. What's the long game here? Chase out the scientists, then what? Develop gene editing locally under military command? If you're seeing how deep this rot goes, say it. Comment, share, and let's keep the microscope pointed where it matters. Traoré called this breaking free from Western science. But Bloomberg Africa reports that Burkina Faso lost over $27 million in projected malaria R&D funding in 2024 alone due to project cancellations. That's money that would have gone into labs, salaries, training, even rural health posts, and yet, military spending rose by 14% the same year, per IMF country data review. So here's the new national equation: less science, more guns. And malaria? Still here. It's not sovereignty, it's suicide dressed in camouflage. As an American, I've seen public institutions screw up, but even in our messiest moments, we don't burn the lab and fire the scientists, then blame imperialism when kids start dying. This isn't anti-colonialism, it's self-sabotage. Here's a hypothetical for the international community. What happens when more countries start pulling the sovereignty card to block science even in the face of epidemics? Do we walk away? Do we push back? Or do we keep letting fear write health policy? Drop your take. And if you think silence enables more than disease, hit that, like, share, and subscribe. Because global health doesn't survive in echo chambers. When a government claims to protect its people, but the people keep dying, you have to ask, who's being protected here? And from what? Because in the name of national pride, Burkina Faso has now isolated itself from one of the most urgent global health fronts, the fight against malaria, and no one's applauding. You don't win respect on the global stage by shutting the door on the lab. According to the Global Health Security Index 2024, published by the NTI and Johns Hopkins Center for Health Security, Burkina Faso's score for international cooperation readiness dropped from 54.2 to 38.6, a significant collapse attributed to the abrupt termination of cross-border malaria programs. Additionally, The Guardian reported that 3 major regional science summits in West Africa, in Bamako, Dakar, and Accra, did not invite Burkina Faso in 2024, citing concerns over policy volatility and political hostility toward bioscience. Even the Africa Centers for Disease Control, Africa CDC, removed Burkina Faso from its list of priority pilot countries for gene-based vector control initiatives as of March 2025. Source: Africa CDC Strategic Roadmap. What does that mean in plain terms? It means this country, once a pioneer in next-generation mosquito control, is now considered too unstable to trust with a test tube. So while Traoré claims to be building independence, what he's actually building is irrelevance. Ask yourself, is national sovereignty really about standing tall or standing alone? Drop your view in the comments. And if you think science should connect nations, not divide them, hit share, hit like, subscribe. Let's amplify what matters. Let's talk about the people. A Human Rights Watch report from late 2024 cited a growing distrust within local communities toward their own government's handling of health matters. In interviews across the Center-Sud and Est regions, residents expressed confusion and anger. They told us Gates wanted to harm us. But since they stopped the program, more of our children are sick, said a schoolteacher from Tenkodogo. They ban science, but they don't ban the mosquitoes, a local elder told Jeune Afrique. Meanwhile, Burkina Faso's Ministry of Health has not released updated malaria mortality statistics since July 2024, breaking with the standard quarterly reporting protocol required by both WHO and the Global Fund. Silence, secrecy, sickness. So maybe the people aren't being protected after all. Maybe they're just being used as props in a nationalist play. In the U.S., we screw up healthcare policy all the time. But there's still a basic principle: accountability. When things go wrong, there are hearings, data, demands for transparency. In Burkina Faso, the strategy is burn the evidence, ban the questions, and blame the foreigners. That's not a health ministry. That's a political firewall. So here's the uncomfortable truth. We're no longer watching a debate about mosquitoes. We're watching a nation choose fear over fact, control over care, and image over impact. How many lives should be sacrificed to protect a fragile ideology? You tell me. If this hits a nerve, comment. If it raises questions, share. And if you believe the world needs more transparency, not less, subscribe.